Angioplasty is where typically the cardiologist will go in through your groin and he'll inflate a balloon and most likely put a stent in a blockage in the artery. Bypass surgery is what most people call open heart surgery, and so you're actually using either an artery that runs down the inside of your chest wall, or sometimes you can use an artery from your forearm or a vein from your leg, where we're actually sewing a vessel on past the blockage in your heart. But this completely depends, and a lot of times it's a close team effort between the cardiologist and the cardiac surgeon because it really depends upon the patient's anatomy. You typically have, or most people have, 3 main arteries of your heart, but they come off like trunks of trees and they give off lots of branches. Everyone's heart's a little different. So if you have a single blockage in your heart that's out on the periphery, most of the time you'll have balloon angioplasty. They'll put a stent in that one area. If you have multiple blockages, or if there's a block in a very difficult spot to get to with balloon angioplasty, then typically the cardiologist and the cardiac surgeon will collaborate and decide what's best for the patient. And a lot of times they'll like to go to open heart surgery.
Yeah, exactly. You know, the lucky thing for humans is that blockages in the arteries of the heart tend to occur in one spot, you know, which is a kind of a unique thing. It's not a diffuse process along the entire vessel. There's typically one area which has a narrowing in it, and that one area can often be dilated and expanded with a very thin balloon and then a stent placed to hold it open. And so most people initially will have that single blockage which brought them in with symptoms, and that can be stented or angioplasty. If there are multiple blockages in multiple vessels, typically two or three of the main arteries that Dr. Taylor mentioned, two or three of the main vessels have blockages in them, and the heart function is good, and the patient is relatively young, then surgery typically gives you a better outcome. In some people, they'll have not just a single blockage, a focal blockage, but they'll have a diffuse area of blockage that would be difficult for the cardiologist to treat the entire area. The stents would require multiple stents, and that doesn't usually have a good outcome.